we are at Kennedy High School in Bloomington. We have a large testing event for COVID-19.
The State Emergency Operations Center and PICA Head Start have been doing these events around different communities, and they reached out to our school district, and we then reached out to the City of Bloomington Public Health, and we've all partnered to bring this event to our community. There's a lot of logistics, about a month's worth of planning and the facilities planning and outreach to get to where we are today.
We wanted to make sure that we were offering COVID testing for our families and our staff. And at that time it was in preparation to reopen our centers. We wanted our staff to get tested, and we wanted our families to have the opportunity to get tested for themselves so that they felt safe and comfortable in bringing their children back to our centers.
Well, there is clearly interest and concern here in the community, judging by how many people have signed up for appointments. So we're responding to interest and concern that members here in Bloomington, Richfield, Edina area are expressing. Two, if we can find people who are asymptomatic but positive and work with them to isolate and contact trace, provide supportive services, we can do our level best to keep the schools and, again, our local economy humming along.
I'm here this morning because I'd like to get my family tested because I don't know if I'm asymptomatic, my wife is asymptomatic. We don't know that. And because of the environment that I work in, I do everything I can so I don't bring it back home to my family.
These testing events, you know, it's very easy, it's not painful, and so it's really been good for them to come and we tell them those things so that they are hopefully now taking advantage of maybe other testing events in the future and recognizing the importance of getting tested.
We know that there's a lot of anxiety around the COVID-19 and specifically around testing for COVID-19, as well as some barriers, whether they're real or perceived barriers. And so by having it an event like this in our community, a large-scale, accessible event, we are able to help remove some of those barriers for specifically for families of color and typically underserved communities that might not have easy access to healthcare and to testing.
This event is also a no-barrier testing event, so that means that we are not going to be looking for insurance. That is absolutely not a barrier to getting tested. Anyone and everyone is welcome. We do have interpreter services on site as well for those who speak Spanish, Somali, and Vietnamese, and so we highly encourage everyone to come out, and then also let us know if there's more need in the community too. We are here to listen to everyone, and if you are finding that you need assistance in any way, please call the Public Health Department and we will get you connected to resources.
So we work with the major labs here in Minnesota, which is Mayo Clinic, the University of Minnesota, and typically we see 48 to 72 hours when people start receiving results, but that can vary. It can be a little longer.
Other conflicting guidance that's out there right now is that asymptomatic individuals do not need to get tested, and with the City of Bloomington Public Health Division, we are making sure that that is not the case. We want anyone to get tested because we know that asymptomatic people can be out in the community and thus spreading the disease more.
I think this is very important for these community partners to come together like they did and offer this, and I would like to see more people just come out and do it. I know you're afraid at first, but you know what I'm saying, it's better to be safe than sorry and not know if you are the one spreading it. So it's better to actually come out and know than not to know.